Encephalitis, what it is and what to do. Hello and welcome to this video on encephalitis, a serious condition that affects the brain. In this video, we will cover the following topics. What is encephalitis and what are its symptoms? How common is encephalitis and what are its consequences? What are the causes of encephalitis and how can it be prevented? What are the types of encephalitis and how are they different? What are the treatments for encephalitis and how effective are they? What are the challenges of living with encephalitis and how can they be overcome? What are the diagnostic tests for encephalitis and how do they work? Let's begin with the first topic. What is encephalitis and what are its symptoms? Encephalitis is a condition marked by inflammation of the brain, often triggered by viral infections. It presents a diverse range of clinical manifestations, turning it into a medical emergency. Recognizable symptoms include fever, headache, sudden drowsiness, behavioral changes, disorientation, language disorders, and convulsive seizures. However, some cases of encephalitis may have mild or no symptoms at all, making it difficult to diagnose. Encephalitis can affect anyone regardless of age, gender, or ethnicity. However, some groups of people may be more vulnerable, such as children, elderly, immunocompromised, or travelers to endemic areas. Now let's move on to the second topic. How common is encephalitis and what are its consequences? The exact incidence and prevalence of encephalitis are unknown, as many cases may go undetected or unreported. However, some estimates suggest that encephalitis affects about 4.3 to 16.7 per 100,000 people worldwide every year, with higher rates in developing countries and tropical regions. The mortality rates associated with encephalitis are notable, spanning from 5% to 20%, underscoring the urgency of timely intervention. Moreover, over 20% of those who survive encephalitis experience persistent long-term sequelae, encompassing a broad spectrum of challenges, such as cognitive impairment, behavioral changes, motor dysfunction, seizures, language and communication disorders, neurological deficits, psychosocial challenges, fatigue, weakness, sleep disturbances, and epilepsy. These statistics emphasize the critical importance of not only preventing encephalitis, but also addressing its aftermath comprehensively. Next, let's discuss the third topic. What are the causes of encephalitis and how can it be prevented? Encephalitis can be induced by a multitude of viruses transmitted through various routes. Key culprits include herpes simplex, HSV1 and HSV2, cytomegalovirus, CMV, zoster virus, VZV, West Nile virus, Japanese encephalitis virus, rabies virus, and human immunodeficiency virus, HIV. Understanding the viral sources is crucial for effective prevention strategies. Preventive measures include maintaining robust hygiene practices, such as regular hand washing, showers, and proper hygiene etiquette during coughing or sneezing. Vaccination is pivotal in reducing encephalitis cases caused by measles, mumps, rubella, and other preventable viral infections. Dr. Anthony Fauci, a leading expert in infectious diseases, emphasizes the pivotal role of vaccines in preventing viral infections and consequently encephalitis. Additionally, avoiding exposure to potential vectors, such as mosquitoes and ticks, is essential for preventing encephalitis caused by arboviruses. Wearing protective clothing, using insect repellents, and eliminating breeding sites are some of the ways to reduce the risk of bites. Travelers to endemic areas should also consult their healthcare providers before departure and follow the recommended precautions. Now let's explore the fourth topic. What are the types of encephalitis and how are they different? Encephalitis is categorized based on causative viruses, highlighting the diversity of its origins. Herpesvirus encephalitis, involving HSV1, HSV2, CMV, VZV, HHV6, HV8, and Epstein-Barr virus. These viruses can cause encephalitis by reactivating from a latent state or by primary infection. HSV1 is the most common cause of sporadic encephalitis in adults, while CMV is the most common cause of encephalitis in immunocompromised patients. VZV can cause encephalitis as a complication of chickenpox or shingles. HV6 and HV8 can cause encephalitis in transplant recipients or patients with AIDS. Epstein-Barr virus can cause encephalitis as a complication of infectious mononucleosis. Enterovirus encephalitis, encompassing polio, causative and hepatitis viruses. These viruses can cause encephalitis by invading the central nervous system through the bloodstream or the nasal mucosa. Poliovirus can cause encephalitis as a complication of paralytic poliomyelitis. Causative virus can cause encephalitis as a complication of hand, foot, and mouth disease. Hepatitis viruses can cause encephalitis as a complication of acute or chronic liver infection. Measles, mumps, rubella, MMR. The incidence of encephalitis related to these viruses has significantly decreased due to vaccination. However, these viruses can still cause encephalitis in unvaccinated or partially vaccinated individuals. Measles virus can cause encephalitis as a complication of measles rash or as a delayed reaction several years after infection. Mumps virus can cause encephalitis as a complication of mumps, parotitis, or orchitis. Rubella virus can cause encephalitis as a complication of rubella rash or as a congenital infection in newborns. Central European encephalitis, transmitted by tick bites or unpasteurized infected raw milk. This virus can cause encephalitis in 2 phases: an initial flu-like illness followed by a neurological phase with meningitis, encephalitis, or myelitis. The neurological phase can be mild or severe, depending on the strain of the virus and the immune status of the host. Japanese encephalitis, prevalent in rural areas of Asia and the Western Pacific, transmitted by mosquitoes. This virus can cause encephalitis in humans and animals, especially pigs and birds. The infection can be asymptomatic or symptomatic, ranging from mild fever to severe encephalitis with coma, seizures, and paralysis. The mortality rate can reach up to 30%, and the survivors may have permanent neurological sequelae. Dr. Jane Seward, Deputy Director of the Viral Diseases Division at the U.S. Centers for Disease Control and Prevention, CDC, emphasizes the importance of understanding the distinct types of encephalitis and tailoring preventive strategies accordingly. Moving on to the 5th topic. What are the treatments for encephalitis and how effective are they? Early detection remains pivotal for favorable outcomes, but encephalitis often faces challenges in timely diagnosis. Varicella stands out as the singular drug proven effective against encephalitis symptoms. It is the first-line treatment for herpesvirus encephalitis and can reduce the mortality and morbidity rates significantly if administered within 72 hours of symptom onset. However, acyclovir is not effective against other types of encephalitis, and there is no specific antiviral therapy available for most of them. Therefore, the treatment for encephalitis is mainly supportive, aiming to control the inflammation, reduce the intracranial pressure, prevent secondary infections, and manage the seizures and other complications. Dr. Angela Vincent, Professor of Neuroimmunology at the University of Oxford, underscores the significance of early treatment to improve patient outcomes. She also highlights the need for more research and development of novel therapies for encephalitis, such as immunomodulators, monoclonal antibodies, and vaccines. Finally, let's talk about the 6th topic. What are the challenges of living with encephalitis, and how can they be overcome? Acknowledging the varied nature of sequelae is crucial. Early detection, medical intervention, and tailored rehabilitation programs, including physical, occupational, and speech therapy, contribute to mitigating the impact and enhancing outcomes for individuals dealing with encephalitis-related consequences. However, the recovery process can be long and challenging, requiring ongoing support and care from family, friends, and health professionals. The psychological and emotional aspects of living with encephalitis should not be overlooked, as they can affect the quality of life and well-being of the patients and their caregivers. Depression, anxiety, post-traumatic stress disorder, and social isolation are some of the common issues that may arise after encephalitis. Therefore, counseling, psychotherapy, peer support, and education are essential components of the holistic management of encephalitis. The Encephalitis Society, a global charity that provides information, support, and advocacy for people affected by encephalitis, is a valuable resource for anyone seeking help or guidance on encephalitis. Their website, www.encephalitisinfo, offers a wealth of information on encephalitis, including fact sheets, podcasts, videos, stories, and events. Have you ever experienced any of these symptoms related to encephalitis? Do you have any stories to share about living with encephalitis? We would like to hear from you down in our comments. Thank you for watching this episode of Joyful Living Plus Empowered Life. We hope you enjoyed it and learned something new about encephalitis. If you have any questions or comments, please leave them below. Stay tuned for more videos. Please like, comment, share, and subscribe. We'd love to hear from you. Until next time, stay curious and keep learning.